Hello everybody, good morning. Welcome to my channel Dentistry Comforts. Today we are going to discuss about the topics related to pharmacology, I mean the calcium channel blockers. So let's see what are calcium channel blockers in a very simplified way. Now, calcium channel blockers. They are an important class of cardiovascular drugs which act by inhibiting the L-type voltage-sensitive calcium channels in smooth muscles and heart. Okay, so mostly they are important class of cardiovascular drugs and they act by inhibiting the L-type voltage-sensitive calcium channels in smooth muscles and heart. Classes of calcium channel blockers. As I've already said that for any classification in pharmacology, there you can always make mnemonics. So when you make mnemonics for any drug, so it will be very easy. Okay, so you have the please be daring. Okay, please be daring. P for phenylalkylamines, and B for the benzothiazepines, and D say you have the dihydropyridines. So you have the please be daring. Okay, now in phenylalkylamines you have the verapamil, and benzothiazepines may you have the diltiazem, and in dihydropyridines you have the nifedipine and philodipine. So how to classify? You have that verapamil say it is very, and diltiazem say it is danger, and say you have the note nifedipine, and P say you have the pick. So it is very very danger, note, and pick. So these are the mnemonics: please be daring, and very danger, note. So P for phenylalkylamines, B for benzothiazepines, D say dihydropyridines, and V say you have the verapamil, D say you have the danger diltiazem, and say you have nifedipine, and P say you have philodipine. Now you have the important factors of calcium channel blockers. The two important factors of calcium channel blockers is that first factor ये है कि smooth muscle relaxation. Second, you have the negative chronotropic, ionotropic, and dromotropic action of heart. So these are the two important factors of CCBs. Okay, so you have the smooth muscle relaxation, negative chronotropic and ionotropic and dromotropic action on heart. Now smooth muscles. The smooth muscles actually depolarize by inward movement of calcium through the voltage sensitive these calcium channel release more calcium from intracellular stores, and they bring together about the excitation contraction coupling. So basically what happens is that the calcium channels, okay, in calcium channel blockers, the calcium channels actually play a very important role because they cause release of more calcium from the intracellular stores. Okay, calcium channel है तो calcium बहुत ज़्यादा होगा in the intracellular stores, and they bring about the excitation contraction coupling. Okay, what is contraction coupling? In the muscles. Okay, now the calcium channel blockers they also cause relaxation by decreasing intracellular availability of calcium, relax arterioles, and mild effect on veins. It is very simple. The thing is that calcium channel, when they want contraction, okay, when they want contraction, so they will release more calcium. Okay, and when they cause relaxation, so they will decrease the availability of calcium from intracellular calcium. So relaxation जब होगा तो relaxation arterioles will be there, okay, and there will be mild effect on veins, and there will be less availability of calcium. And when contraction coupling is there, so more, more, what more, this thing, release of calcium. Okay. Now, smooth muscles. The smooth muscles depolarize by inward movement of calcium through voltage sensitive channels, and these calcium channels, they release calcium from the intracellular stores to bring out the excitation contraction coupling. So what is a smooth muscle? Depolarized by inward movement of calcium through the voltage sensitive calcium channels, and of course these calcium channels release calcium from the intracellular stores together and bring about the excitation contraction coupling. As I've already said कि excitation contraction coupling, what is it? More, जहाँ पे ज़्यादा calcium अगर release होगा तो of course you will have the contraction coupling. और depolarization कैसे होता है smooth muscles का? When there is inward movement of calcium through the voltage sensitive calcium channels. Okay, so it's very easy. Okay, more calcium channels, the contraction coupling, less calcium release, relaxation. Okay, look at this diagram. Sometimes when you have difficulty in learning any kind of answer, so you can frame some kind of diagram. So here about the calcium, intracellular calcium, how it releases and how it moves inwards and outwards. For this you have the diagram. Okay, so this is the diagram of a muscle. Okay, and this is the calcium channel. Okay, like कोई channel होता है किसी चीज़ का. Okay, so this is the calcium channel, L type voltage gated calcium channel, and these are the calcium blockers. Okay, and यहाँ पे from this channel calcium is released. Okay, and intracellular calcium, if it's released, if it comes outside so much, if it comes outside, so muscle will be contracted. Okay, and okay, so this is the kind of the thing that how the muscle contraction occurs. और ये है depolarization, smooth muscle relaxation. ठीक है. Okay, so जो contraction होता है तो from the intracellular stores there is release of calcium, and when there is smooth muscle depolarization, so this is how the muscle contraction occurs. Okay, ये inside calcium comes out, so it is muscle contraction, जिसको कहते हैं coupling. And if the calcium moves outwards, मतलब if it does it, so muscle relaxation होगा. ठीक है. And depolarization is the way how the smooth muscle contraction coupling occurs. So this blue kind of thing, you can call it as calcium channel blockers, or ये channel है. This is the gate of कोई भी channel होता है तो there is a gate, so it's called the voltage L type voltage gated calcium channel. और ये जो brown figure है ये muscle है. Okay, और ये जो this round thing, it's a store. Okay, calcium store. Okay, now let's discuss about the calcium blocking drugs. We will just discuss, but the basic concept of the calcium channel blockers we have already understood, and now we are going to discuss about the calcium channel blocking drugs in our next session. Okay.